He's coming.
Dear Chairman, dear ladies and gentlemen, good afternoon. Over the next few minutes, I'm going to go through the curriculum of our International Studies of Medicine, which is actually a copy of the newly revised program of our Greek student. And I'll go again through history, because we have to remember that these things were evolved during the last years. And you know that our medical school, which has its 80th anniversary, was founded in 1942, and it's composed by 83 departments. And the so-called preclinical lessons and courses mainly are held in the campus of the university. And then after, when the students need to practice, they practice in the 7 hospitals which are affiliated with our medical school. 4 are the main pillars: the Papageorgiou Hospital, Papanikolaou Hospital, Hippocratean Hospital, and Ahepa Hospital, which is the closest to the medical campus. And also we have other 3 hospitals affiliated, which are more specialty orientated. And what do we ask from our students, and what is their plan during their education? As you know, in different countries, they follow different schedule, and we follow the common European one with 6 years, which is divided into 12 semesters, 15 weeks per semester, and we have in between 3 weeks of an exam period. And all you are familiar with ECTS, which is how to measure the validity and how to measure the workload of what the student is supposed to do. And our program is supposed to have 360 units. And as I told you, the program has been revised recently, the Greek program, and the English-speaking program is just, let's say, a clone of this newly revised program with some differences, and we'll go through this over the next few minutes. As I told, I said in the morning, and Professor Triandafyllou has pointed it out, we try to keep the new medical students happy from the first day. I remember when I entered the medical school, I had to go to mathematics, physics, and chemistry, and all of this, and biology was the closest to medicine course. So always we wanted to wear the white gown, and very early we want to go to a HEPA hospital, dear Chairman, and to try to be surgeons after the 2nd or the 3rd year. But we have realized that this is very important for the medical students, and we try to keep them happy from the very early beginning. And as it has been shown before, we introduce them to clinical skills and practice from the first days. And I'm sure that their interest is starting. They get all the basic knowledge which they need to have in order to build all their clinical skills later on. But their curiosity and their will to play, if I may, with the patient, or with all these techniques which sound like coming out of space, they are accustomed to this. And you see also that in the third semester, they have this very, very important course, communication with the patient. When I graduated here, and I've done part of my specialty here, and I thought that was very good. And when I went abroad to the UK, I was really shocked to see how other doctors were communicating with the patient and the nurses and the relatives. And I was coming from another world. And I thought, I missed so many things, and I had to learn everything from the beginning. And at least what my generation didn't understand how, and many doctors today, they don't know how to communicate with the patient. And as it has been shown before that if there is an argument, and Professor Φόρογλου said, if you have an argument with the patient, or if you've been sued at the end, usually you don't make a medical mistake. Very few medical mistakes are done today, but it's because your attitude and your ignorance and your way of bad communication with the patient or with their relatives is there. And the patients, the young doctor should be trained. And if I may, Mr. President, you know the film that the famous cardiac surgeon was ill and had to be operated, and he was very selfish, etc. And then he turned into a lamb, you know. So I was, again, in some medical schools, they ask for the students to wear gowns, and play the role of the patient for 1 or 2 days. And again, these tools are very, very important. And I can tell that you, as already been a patient, so the way somebody communicates with you is very, very important. So we have the 3 levels of studies. The first 2 years is the preclinical, and then the clinical rotations, and at the end, the 6th year is the internship. In the UK, you know that, or the British trained system is they stop in the 5th year, and the 6th year they spend 6 months as an intern in surgery and 6 months in general medicine. We have this mobility with the Erasmus program, and we want this to carry on, and we're very happy to accommodate Erasmus students. And of course, as all the modern programs, there's a continuous evaluation, and all the proposed changes may take action quite soon. Also, we want the patient, the medical students to be very active and pursue research projects. As I told you, the clinical rotation starts from the 3rd year, and while there is a novelty, which is again something which started with the Greek part, but with the awesome program, it's more evident because probably I would say foreign students are more used to this kind of service, and each student has his own or her own academic advisor from the first day. And what is the faculty of the medical school? The majority are coming from the Greek program, and all of them, most of them have agreed to participate actively. And also new places have been funded by the program on each course. So the program funds new places for readers. The student has to be there. COVID experience shifted us to the electronic learning. we try to reduce it now, but we do that as conditions are okay for this. You saw that there are simulation techniques. Also, whatever it's done, it should be written in a logbook. We kept saying this for many, many years, not only in medical school, but also during different kinds of specialties, especially with the surgical specialties. And I'm not sure if still in 2022, they do have a logbook in ophthalmology or neurosurgery or, in cardiology with us. They just started doing that. The university provides all the academic tools through the internet. We want the students to be very active, and they play the role of the teacher as well, because if you cannot try to teach, and a good teacher is somebody who understands and knows the topic. So if you don't know the topic, you cannot actually teach people. Also, they're involved with research projects. The curriculum is based mainly in the problem-based learning, as it was being told before. And of course, teamwork is essential for not only for modern medical schools, but for everything we do in this in the 21st century. Sorry. So, how are the students promoted to the next year? So they should have passed all required courses, and of course there are special cases, and we anticipate advancement to the next level when you have completed at least the 2/3 of the previous year's courses, but that's not the usual case. In the majority, we require that if there is no specific reason for not doing so, for the students to have passed all of their courses. For the non-Greek speaking students, we provide teaching for 6 semesters, and in the 3rd year, they're going to be able to communicate in Greek, mainly not for, they can, in order to communicate with the patients, because, okay, our doctors, the vast majority know how to communicate in English, but the patients know not. But this gives the opportunity to take a good history. What about people who have a native tongue Greek? Because, as you know, quite a few medical students are coming from Cyprus. There are certain conditions where they are exempted from the Greek language tutorials, but on the other hand, they have to present and show that they know how to speak Greek, and they are asked to provide project on each semester. Today, this morning, we had the joy to hear all these projects and to listen to these presentations, and we were very excited for this. Somebody who has at least 90% of presence during the relevant courses has the right to participate in the finals. And the final grade is a mixture of participation, research program, project, and the final exam. So with this kind of grading, we feel that the student is judged more fairly. At the end of the day, everybody asks, what kind of degree do I get? They get the same degree as the Greek students get, the Ptychio Iatρικής, the MD. And this gives access to postgraduate studies, doctorate in medical science, and of course, they have the license to practice the medical profession everywhere within the European Union and the globe. and especially for the European Union, they don't need to pass exams, etc. If they're interested to go to the States, the same rules that apply to other European citizens, so European medical schools, they have to pass the relevant exams. So at the end of the day, we have to say that our program is recently has revised. It's been revised all the time, and we listen to the echoes and what the students think, how boring we are or how exciting we are, and take it from there and change our attitude every year to become better and better. Thank you very much.
Thank you. So, thank you, Professor Βασιλικός. So, as it was mentioned, the well-being of the students is a responsibility of the medical school and the emotional stability. And for that reason, we have asked Anna Tsaprani, who is officer in the International Studies Office, and she will be linked in a moment to present the community integration of these international studies in Thessaloniki.